First Five is a unique initiative that really works to promote the healthy mental development of children from birth to 5 years of age. And we know from research that children's brains grow the most during the first 5 years of life.
We partner with healthcare providers across the state to look at social emotional delays, developmental delays, and family risk factors in children 0 to 5 and their families.
First Five doesn't just look at the physical development of children, it also looks at their social and emotional development, family stress, autism, and maternal and caregiver depression.
1 of every 6 children do not have the skill that they need in life and at school. So hopefully with early identification we can prevent further delays, and with proper treatment that child should progress better developmentally.
Really, First Five's goal is to really link that child and family to services in the community that are going to intervene early and prevent that small concern from then, becoming a larger, more complicated, more time-consuming problem down the road.
It's so much easier to correct those delays now rather than later. And it's also a cost savings measure for insurance companies because we're able to catch those delays while they're young, where they only need to be seen maybe a few times rather than a lot more when they're older.
We have a few medical consultants who we can deploy out to primary care practices to educate and train on developmental screening and surveillance, tools, billing, just how to implement the First Five model.
So they can make a referral because of a delay in the child, or they can make a referral because mom is having something going on that we can help her with.
One of the best success stories that I've heard so far is that a physician actually referred herself into the program because she wasn't as familiar with all of the referral resources in her area. So I think that really goes to show that anybody can be referred into First Five. We don't just serve one population, we really serve everyone.
It's a really helpful tool for pediatricians. There's no way as a provider that I can possibly know all of the people that I need to know to provide care to my patients. And so instead of having 20 people in my virtual Rolodex of contacts, I have one person, one care coordinator that I can call who can really help me connect my patients to any kind of developmental services that they need.
For every 1 referral we get from a provider's office, we end up making an additional 3 to 5 referrals out to other community providers.
First Five is very important from a public health standpoint because it's all about identifying early and prevention, and we're really looking at getting healthier children with better outcomes at an earlier age so that they can become healthier adults and then ultimately more productive and save on return on investment.
The goal is to intervene early and help as soon as we possibly can.